Hello, my name is Dr. Linn. I would like to welcome you to the Thyroid Workshop video. I think you will find it very informative and you'll be taking home a lot of valuable information about thyroid conditions. And you will be discovering why 90% of women on thyroid replacement hormones will continue to suffer and what they can finally do to end their suffering. Now, before we get into the workshop, I want to go over some rules with you. Okay? First of all, you have a chronic condition. Although medicine is fantastic at acute conditions, they are horrid at treating chronic conditions. So therefore, they are not going to get you better. You have to do more than medicine. Next, our healthcare system is pharmaceutically driven. Let me ask you a question. Think of two things right now that could help your health. Okay. Did any of you think take more medication? No. Medicine is not the solution. Next, you are going to have to think outside your insurance plan and pay for some of this. You know, to get good quality care, you're gonna have to pay for it. Okay, your insurance might pay some of it, or a lot of it, maybe none of it. So you have to be prepared to pay for it yourself if you want to get good help. We do have the solution for these types of problems if you listen to what we say. If I don't think I can help you, I will tell you I can't help you and send you to the proper provider. Okay? Alright, you also must be committed on a level of 10. On a scale of 1 to 10, you have to be that 10. You have got to want to get better. Alright? Just like if someone was holding your head underwater and you wanted a gasp of air, that's how bad you want to get better. So commitment is a big thing. Next, you must be prepared to make a lifestyle change. There's a big lifestyle change to get your health back, and you will get your health back if you do these things. You know, you might have to change your diet. You're going to have to get rid of sugar, soda pop, smoking, chips, eating flour. You're going to have to make a lot of changes as far as your diet goes. Maybe your nightlife, your drinking. These things are going to have to change. So there's a big lifestyle change if you want to get better. Next, you must take responsibility for your own health. You know, I can lead you to the water, but I can't force you to drink it. It's not your spouse, it's not your mother, it's not your father, it's not your children that is going to get you better. It's you. You have to drink the water. We did that. Okay, the greatest wealth is health. You know, once you get sick, it's a rough road. Okay, we'll skip that. All right. You know, time is ticking away. Life is very short. My question to you is how many more months are you willing to suffer before you do something about it? You know, I see people wait and wait and they never do anything about it. I think they're too concerned about they can't change, or they're worried about the money. We try to make it affordable for you, and you'll see it later at the end of the workshop. Now, most of my treatment is based on what is found in this book and by going to seminars by this author. His name is Dr. Dadis Karazian, and he is renowned. He is sought after all over the world because he has solutions to these types of thyroid problems. Okay? So this is where I study from. Went to a lot of seminars and postgraduate studying to get the knowledge that I need to help patients naturally. This website, lifechangingcare.com, is where you can find doctors who use this method. And there are over 500 doctors who consult with each other with their expertise on how to help patients. I am a member of this network. And if you want to see testimonials of other people who have done this program, just go to lifechangingcare.com and you can click on testimonials and you'll be able to see success stories with our program. Alright, now all chronic health conditions have some common threads, like thyroid conditions, fibromyalgia, chronic fatigue, peripheral neuropathy, Crohn's disease, infertility, polycystic ovarian syndrome. It goes on, especially the autoimmune conditions. And there's 3 common threads that usually are common to all these problems, and it's oxygen deficiency, neurological misfiring, which is the brain is overfiring or underfiring. We help that. And metabolic imbalances, chemical imbalances in the body that's not letting you get better. Today we're going to be discussing the thyroid gland, and it's a very important gland because it supports your bone metabolism, your immune system, your gastrointestinal function, your liver, your sex hormones, your fat burning, healthy cholesterol levels, insulin and glucose metabolisms. It's just tied into everything. So it's important to have proper thyroid function. Alright, anytime there's a breakdown in any of the events the thyroid performs, if there's a breakdown, you are going to start to get symptoms. Okay, now every cell in your body has thyroid receptors. Every cell needs thyroid hormone in order for that cell to function properly. Now these receptors attach to the thyroid hormones and bring them into the cell. Receptor catches it, pulls it into the cell where it's used to do its job. Now the key to thyroid health is what? Is to get just enough of these hormones inside your cells. If you don't get enough of the hormone inside your cells, you start to get symptoms of hypothyroidism. You might get fatigue. You might start to gain weight even if you're on a low-calorie diet. You can get depressed. You might have infrequent bowel movements. You might be overly sensitive to cold weather. You can get muscle cramps even while at rest. You get poor circulation. You might have cold hands and cold feet. Itchy, dry skin, stomach pain, gas, bloating, dry, brittle hair that falls out easily, edema, swelling of the face, and brain fog, depression, lack of motivation. You're just not running right. If you get too much hormone, you get symptoms of hyperthyroidism. And that's the opposite. You might be racing. Your heart might be racing. You have palpitations, inward trembling, increased pulse rate. You're nervous. You're emotionally distressed. You can't sleep. You're sweating. You can't gain weight. You're just a mess. And it can be very dangerous. So these are the 2 conditions that occur. Now to understand thyroid problems, we need to understand the thyroid gland and how it interacts with your body. Now you have to understand all the systems of the body work together. If you're chronically ill or you're sick, you have to understand that everything affects everything else. And you have to look at everything all at the same time. You can't just look over here now and then look over there 2 months later. You have to do it all at the same time in order to do the proper management and treatment. Now the thyroid gland talks to the immune system talks back. Talks to the gut, and it talks back. Talks to your brain, the brain talks back. Talks to the endocrine system, and it talks back to the thyroid. Each affects the other. All these systems work together and affect each other. You have to look at all of this stuff at the same time to get a proper idea of what the body's doing. How it all works. Looks complicated, but I'm going to go through this real quick, so we'll go over it again. First of all, your brain releases, well, the hypothalamus releases what's called TRH. The TRH goes to the pituitary gland. The pituitary gland releases TSH. The TSH goes to the thyroid gland, where it activates TPO, which is an enzyme that makes your thyroid hormones. The thyroid gland will produce 93% T4, 7% T3. Important point. T4, the 93% of the hormone, is inactive, does nothing. Has to be converted to T3 in order for it to do its job and get in the cell. Now this T4 and T3 hops on what's a protein called TBG. You can think of it as a little boat. And the boat's going to carry all this T4 and T3 to the liver, gut, and other tissues. Now that T4 is going to get converted to T3 in the liver. 60% of it will get converted in the liver. Another 20% in the gut, another 20% in other tissues. Okay? So it goes from T4 to active T3, and it's going to go to the cell receptor site we talked about. And the cell receptor site is going to pull it into the cell where it can do its job. Let's forget about this stuff. Let's go through it again real quick. Hypothalamus releases TRH. TRH is going to go to the pituitary. The pituitary is going to release TSH. TSH is going to make the thyroid activate TPO, and it's going to make T4, and it's going to make T3. Okay, remember, T4 is inactive. 93% of the hormone's T4. That's important to remember, because it's going to tell us about conversion later. Then it's going to get in circulation. It's going to go to the liver. Remember I said it gets converted from T4 to T3 in the liver, 60% of that T4. Okay, remember it hops on that boat, T4, T3. Most of it goes to the liver, and it's going to get converted from T4 to active free T3. Okay? Then it's going to go back into the circulation, get carried to the receptor sites and into the cell, where it's going to do its job. Quick review. I don't think we need to do it again, but there it is. That's enough of that. This is another slide that shows you what happens. I don't think we need to go over it again. I think you pretty well understand it by now. So blood tests are key to success or failure. All right, the grossest mismanagement of hypothyroidism begins and ends with the blood test. Have you been told all of your lab tests are normal? This is a big thing. This is where we are different than medicine. Typical lab ranges are not reliable. The ranges vary from lab to lab and from location to location. They use bell curves based on unhealthy people. We use curves based on healthy people. We try to get you diagnosed or see a pattern before you get sick. You know, okay? Functional lab values is what we use, not lab ranges. We use functional lab ranges. They are more sensitive. They are based on healthy function, so they can reveal problems before they are seen on the traditional lab test. Okay, how your labs can be normal, but you still don't feel good. This is how it happens. This is your typical lab range. Everything within this is considered normal. And if it's outside the range, it could be abnormal low. If it's too high, it's abnormal high. This is where they diagnose disease. These are the ranges medicine uses to diagnose your problem and disease. We use functional lab ranges. You see how it's narrower. It's a more healthy range, okay? And we will start to pick up problems when it gets abnormally high in this range or abnormally low in this range. And these areas are the lab findings that most MDs would consider normal, and we do not. But they are not, and you still feel sick. So this is a big difference from functional medicine, holistic medicine, and traditional medicine. What it really means. Okay, most MDs, yes, you say you are sick, but your lab tests are normal. So try this and we'll wait and see how you do. Okay, you're not going to get the help you really need. Okay? You're already starting to get sick when you're in these ranges, and that's where we catch it. Functional range assesses risk for disease before it develops. We catch it before it happens. It's called preventive medicine. For example, let's say your glucose comes back with a 73. The traditional medical lab, 73, it's normal. Their range is 65 to 110. It's real wide. Our range is tightened down, 85 to 100. You got 73. We say you're hypoglycemic. You're starting to lean toward hypoglycemia. Okay? Same thing with your triglycerides. It's 149. They're going to say it's normal. We're going to say you might be starting to get insulin resistance, pre-diabetes. So you see the difference and how important that is when we look at your lab findings. All right, the typical thyroid test that's ordered from your medical doctor is your TSH and your total T4. That's about all they look at. That is not nearly enough to analyze your thyroid function. It's minimal. Okay, your doctor is going to prescribe a simple blood test that provides minimal information which your insurance covers. Then with the minimal test results, you get minimal treatment, which may be a minimal cost at the time, but you're going to pay for it later. Okay, if you limit your care, if you limit your treatments to what insurance is going to pay, you're not going to resolve this type of chronic problem. You're not going to resolve your thyroid issue or any chronic problem. Okay? So, dependence on your insurance company, what they pay, is probably going to keep you sick. Now, conventional medicine is geared towards symptomatic relief and a cure with drugs and surgery after disease is manifest. Our approach, the holistic functional medicine approach, is geared toward wellness and prevention with nutritional and natural support before the disease manifests. It's the difference between night and day. Okay, treating the thyroid gland with hormone replacement therapy is a 50-year-old model. Okay, the treatment hasn't changed one bit. You know, they look at the TSH. If it's high, you get synthroid, levothyroxine, or whatever. Okay, now here's what I was talking about in the beginning. Important concept. 90% of women who suffer with hypothyroidism have what's called an autoimmune disease called Hashimoto's. Now, Hashimoto's disease is an immune system problem. It is not a TSH problem. It is not a thyroid problem. So you will never get better using the hormone replacement model if you have an immune system problem. So we are going to get to the underlying cause of your thyroid problem. No doctors are going to investigate or measure your immune system. This is where we are different. We are going to do all the proper lab tests. We are going to do what we call, which sets us apart, it's a mega powerful, simple test. It's called the Immune System Quiz, where we can see how your immune system is out of balance. Okay, let me explain a little bit about the immune system real quick. You have two systems, the Th1 and the Th2. It's like a teeter-totter, okay? And they should be balanced throughout the day. When you have an autoimmune disease like Hashimoto's, the teeter-totter is out of balance. It's like someone 300 pounds is sitting here and you weigh 150 and you're way up here. So your immune system is way out of balance. And the way Th1 and Th2 communicate is through a protein called a messenger called a cytokine. And these cytokines can block your receptor sites, okay? So it's important to see your levels of your cytokines. And we do this simple test in our office to see which side of your system is skewed. We have to balance it out. And we do that with natural protocols, the proper botanicals, plant extract, nutrients, based on peer-reviewed medical literature that works. Okay? So, doing nothing to address the immune system is going to keep your problem going. Okay? And we have to find out what your immune system is doing. Alright, the thyroid replacement hormone, sometimes it works, often it's just for a short period of time. Also, excess synthetic hormones flood the bloodstream with unnatural amounts, which can cause receptor sites to become less active. Okay, if you pour too much hormone on there, it's kind of like a flower. The receptors are like flowers. You have to water them just enough. If you water your flowers way too much, they wilt and die. Same thing with the receptors. Too much hormone makes the receptors shut down. Can cause a gland to slow down and eventually stop producing its own natural hormone, because why should it if you're giving it medication? It doesn't need to work. Okay? Also, most synthetic hormones do not show up on blood tests. So, hormone replacement therapy only keeps the TSH in a normal range. It assumes the thyroid is the only problem, which it 90% of the time is not. There are 20 different ways the thyroid can go wrong outside of just TSH and total T4. So therefore, treatment is not correcting the cause of the problem, and your condition and symptoms are not going to get better. And if you have one autoimmune disease, your whole body is on the menu. It can start attacking other parts of your body. So it's very important to control this immune attack. Down-regulate it, calm it down, stop it, slow it down. Now, an important point I want to make is once you have an autoimmune condition, you can't stop it, okay? However, don't panic. You can slow it down where it's virtually imperceptible. You have to think of somewhere along the line the genes turned on for you to get the disease. Okay, the triggers could be, there's so many triggers that could have caused the disease, but the genes turned on. You have to think of this as the genes as a light switch. Okay, you flip the switch on, the switch breaks, you can't turn it off. However, you can put a dimmer on it, and we do that through our treatment protocol. We dim it, quiet it down, calm it down, regulate it, so it's not a problem. Okay? Alright, after years of this treatment, why are you still not better? Well, we just explained why you're still having problems, because autoimmunity is present, most likely. Most medical doctors say maybe it's all in your head, maybe because you're lazy, or maybe you need to exercise more. Maybe you really need some psychotic medication. So the next thing they're going to do is give you an antidepressant. It's just going to complicate things. You get tired more. Or maybe it's, or maybe somebody dropped the ball by not doing the necessary tests to give you the proper health care. I think we're almost getting close to done. God, I hope you're patient with this. All right, what makes us different? All cases are treated with a combination. We treat you neurologically and a natural metabolic therapy. Okay. What you have to do with these type of conditions is be a good detective. You have to do comprehensive lab work. You have to be detailed. You have to be persistent. Okay. What we're going to do is a complete thyroid functional test, not just T4 and TSH. We will check those two things, but we're going to do a free thyroxine index, a free T4, a free T3, a total T4 and a total T3, reverse T3, resident T3 uptake, TBG. All these things are important to know where your thyroid could be going wrong. And we will be doing the antibodies, which rarely they do. This is going to measure your immune system, especially the TPO and TBG antibodies, which tell us if you have Hashimoto's. All right, remember, Hashimoto's disease you can have a combination of hypo and hyperthyroid symptoms when you have this. Remember, they are not thyroid problems. Your immune system is attacking that TPO and TBG. If it's attacking your TSH, you get Graves' disease. That's hyperthyroidism. Remember, these are immune problems. There is an imbalance in your immune system that needs to be addressed, and proper testing must be done. Some of the reasons why you get an autoimmune disease there's several. Chemical exposure is a big thing, like if you're exposed to chemicals, plastics, pesticides. The environment in our food is loaded with this stuff. Mercury intoxication, amalgam. There's all kinds of chemical exposure. You could have a hormone imbalance where cortisol is causing a problem with your receptor sites. Antigen responses. You could have food sensitivities. You could have gastrointestinal infections you don't know about, parasites. We'll talk about that. So it's important to do the proper testing to find out what's causing it and to keep those triggers away from you. You don't want to trigger an autoimmune thing. All right, why would your immune system do this? Well, immune system imbalance could be caused from bad blood sugar, cortisol, stress response, adrenal glands, hormone imbalances, as we talked about, cortisol, estrogen, progesterone problems, neurological imbalances where your brain isn't firing properly. Proper testing. We do all that. Okay, an active antigen, your immune system could be imbalanced due to inflammation. You could have a chronic infection, bacterial, viral, mold, fungal, yeast, candida. Could be any of these things. You could have parasites in your gut. Very common. A lot of Americans have it, don't even know it. Could it be sensitive to certain foods? And of course, we mentioned the chemicals, environmental toxins, undigested food that cause leaky gut. If you had antibiotics in the past, steroids, bad diet, you could have a leaky gut, and this could be causing an autoimmune problem. We need to find out if you have that. Heavy metals, mercury seeping into your bloodstream through time. You know, if you have a warm drink, this is when that mercury can get released into your bloodstream. We can check you to see if you have problems with your teeth also. Proper testing. We might use kinesiology on you too. Now, Hashimoto's is the #1 cause, but there are other factors that can lead to hypothyroidism. I want to go through these really fast. Here are some other reasons your thyroid can go wrong. Not just TSH and total T4. Here are 6 major thyroid patterns that medicine doesn't look at. Primary hypothyroidism. This is the only condition where TSH or thyroid replacement hormone will help in this condition. Okay? That's the only one. Second is secondary hypothyroidism, which is due to pituitary hypofunction. This is where cortisol dampens your pituitary gland and you can't make TSH. Okay? So chronic active stress, busy lifestyle, too much coffee, standard American diet, inflammation, infections, postpartum depression, pregnancy amplifies demands on all the hormones. Okay, conventional medicine, there's no treatment or may prescribe hormones due to your symptoms. What we do, we're going to rule out that autoimmune problem, test for stressors, remove and support the adrenal and pituitary tissue nutritionally with our protocols. Another cause is thyroid underconversion. The gland is making enough T4, but it's not getting converted to T3 into liver, gut, or the other tissues. Okay? Maybe it's not getting converted here. Maybe there's a problem with your liver. Cortisol can cause it, free radicals from chronic inflammation. Conventional medicine, no treatment, or they may prescribe hormones. What we're going to do is, again, rule out that autoimmune problem, test for stressors and causes for inflammation, remove those stressors, provide nutritional support to reduce inflammation, improve antioxidant status, and support T4 to T3 synthesis. Another problem, thyroid overconversion. If you have too much active T3 and it's overwhelming those receptor sites, you're drowning them. They close up like that flower. They wilt and die. So maybe there's a TBG problem, that protein that carries the hormones. Conventional medicine, no treatment, maybe hormones. Our treatment, control the blood sugar, whatever the problem is. In some cases, we might have to do a liver detoxification. Maybe TBG is too high. That's another cause of thyroid problems. A big thing is birth control pills here, estrogen creams, things like that. So again, we're going to clear the body of excess estrogen, provide nutritional support for healthy bile formation and liver detoxification. Clean you out, get the system working right, balance it out, good to go. Thyroid resistance. Okay, let's see what this is gonna be. It's the hormones just not getting into the cell. Could be due to cortisol or chronic stress. Could be an oversynthesis of T3. Could be too much hormone replacement therapy. Your thyroid won't accept it. It shuts down. Conventional medicine, same thing, prescribe hormones. What we're going to do is, again, rule out your autoimmune problem, address adrenal malfunction for excess cortisol and homocysteine, which is a protein that can cause a lot of problems with your cardiovascular health and cell function. Okay. We did this, right? So you can get a problem right there. You can get a problem here. You can get a problem here. You can get a problem there. Or here. Or here. So there's different places that the thyroid condition can go wrong. Not just at the gland and the T4 level and the TSH level. It's a whole complex thing. Remember, the key to good thyroid health is getting enough free T3 inside the cells. Thyroid dysfunction is a sign of metabolic dysfunction. Proper testing is crucial. We're going to do a complete metabolic profile, a complete thyroid panel, vitamin D levels. We're going to check for anemia, kidney function, blood sugar levels, cerebellar antibodies if necessary, female hormone panel if necessary. We're going to do to check the immune system out with our immune system quiz. We're going to check your adrenal glands if necessary for excess cortisol. See if you have any food sensitivities. Gluten, dairy, and soy, I would avoid those at all costs. They're pro-inflammatory things. You might need a stool microbial ecology profile test where we'll check for parasites, infections, and things of this nature that could be subclinical. You don't know you have them. Okay, so what makes our office so different? We do everything we possibly can. We do neurological therapy also. Why? Well, here's why. The brain, remember we talked, it all starts in the hypothalamus. Hypothalamus goes to the pituitary. The pituitary goes to the thyroid gland. We need this nervous system tract working right. If it's under firing, the thyroid's going to suffer. It's overfiring, the thyroid's going to suffer. So we determine if you have any neurological imbalances. We call it frequency of firing. Okay? We want everything firing back and forth equally. Sometimes the other side doesn't fire enough. Okay? So, the right brain and the left brain should be equal. They should fire equally. Alright, so how are we going to help your thyroid condition? We're going to find through lab tests, antigens, and things like that, and remove them. We're going to remove any problems that we find. We are going to repair the damaged tissue with specific nutritional support, like we talked about. We're going to balance your immune system with our proper protocol and things like that. And we're going to find through neurological testing how your brain is firing. We're going to improve your brain function with oxygen and brain-based therapies. It's real simple. So, there is light at the end of the tunnel, and that's hope. We can give you hope. We want to help you. So, there's 5 key questions you need to ask. How would you desire, what is your rate your desire to get better? How have your thyroid symptom affected your job, relationships, family, and other activities? What has it cost you in time, money, happiness, and sleep? Where do you picture yourself in the next 1 to 3 years if you don't take care of this problem? That's a good question to ask yourself. Okay, so let's go over this real quick. What I'm offering is a consultation. The consultation is going to be an in-depth office visit where we're going to discuss, your problems and concerns. You're going to be bringing in your lab work and any medical records that we can review. We're going to check your dietary and nutritional status and make recommendations on that. We're going to see if the supplements you're taking are beneficial or actually detrimental to you. And we're going to review your lab tests with a fine-tooth comb to see what's going on there and to see what other tests you need. Okay? And we'll put it all together and get you started on some positive feedback right away, what you should start doing to make you feel better. And we'll also be going the financial part of it. Okay? As far as the finances go, if you're not willing to spend $150 to $250 a month for a while, and what I've said on this video, you just don't understand. You're not sick enough yet. Please, if you think that's too much money, don't sign up because you're just not ready yet. Okay, you're not ready to get your health back. You're not committed yet. Again, remember, if you limit your treatment to what insurance pays, you're not going to resolve this problem. You need good quality health care. Okay, so that's what we're basically going to do. Now, the consultation, the regular fee is $250, but by listening to this video, which you spent at least a good half hour doing, maybe longer, we're going to give you a special offer. If you schedule an appointment and call us, we're going to let you come in for $49, and we're going to go through that thorough consultation and get the ball started. So if you want to come in for this consultation, call our office at 708-574-4018. That's 708-574-4018. Okay, and we will send you a thyroid review packet to fill out. Now you have to get this back to us at least 48 hours before your appointment so I can review everything. Okay? I think that's it. And I have to thank you so much for watching this. I hope it made sense and gave you some insight on how your thyroid really works. Thank you.